I have the honor of introducing the next speaker, Commissioner Kevin Tanner. And I could read this, and it's impressive. He's a smart man. He's well educated. He's done about everything anybody can do on earth. But most importantly, he's changed our state for the better. He is responsible, working with Speaker Ralston, for House Bill 1013 that has transformed mental health. I've been on the Mental Health Board in Georgia for many years. I can't remember how many, and I've told Commissioner Tanner this. I've gotten so discouraged sometimes in the past, but I just kept showing up thinking I was probably irritating them. There was so much to be done. It is not the same department under Commissioner Tanner's leadership. It is a wonderful department, and you can tell it if you know people that work for him. They smile and they're proud of the work they're accomplishing. They're transforming Georgia. And we're really honored and delighted to have him as our commissioner. And anything you got, if you don't know Commissioner Tanner, you get him. He's a regular guy. He's a great man. And we're really proud to have him here to close this session out today. Thank you.
Not sure if I'm supposed to carry this up here or not. That's all right. Well, I appreciate the opportunity to be here, and Dr. Sumner, I'll get up with you in a little bit and give you some money for that introduction because that was way too kind, but I do appreciate that. So I just want to thank Cammie, Dr. Sumner, for inviting me today. I know I've listened in, I've looked at the agenda, I know what a powerful day you've had, and I'm honored to join you for this inaugural event. Rural Georgia is a special place to me. It's a place that I grew up in, that I live in, that I farm in, and I understand the challenges that all of us live and breathe from rural parts of the state. I want to thank the Georgia Rural Innovation Center at Mercer University, particularly, again, Dr. Sumner and CWC Alliance. Dr. Sumner and her team are incredible partners in this state. I was in the General Assembly when this program was established here at Mercer, and it's doing tremendous work. I want to also especially thank and highlight Cammie Wolf-Rice, the founder and CEO of CWC Alliance. She is a fierce partner in the ongoing fight against the opioid epidemic. She's turned her grief into purpose, and she is a shining beacon of hope for others in this community. And as many as you know, she's pioneered the Building the Life Care Specialist model, which I know you've heard about today. An advocate for legislative change, a leader in the state, and a more informed pathways to healing. Cammie really embodies what it means to take something that is probably the very worst, and I know the very worst moment of your life, and turn it into something that really saves a lot of other lives and a lot of other families. So help me thank Cammie for all she does for our state. And Cammie, thank you for working to put this on today. I also want to offer my sincere moment of thanks to all the speakers that you've had today, the healthcare professionals, community leaders, the advocates, and all the guests. And to Mr. Forsyth, thank you for the sobering presentation on the fentanyl crisis. We have a long road ahead of us. It can be a little bit overwhelming at times. To Dr. Sumner's point, there's a whole lot that needs to be done. But we have a lot of good people in our corner, and you saw a lot of those people today, a lot of people who are working hard in the trenches. Today's program, I know, has been very informative. It's been impactful. Thank you to Attorney General Chris Carr, who's really been heavily involved and really at the tip of the spear for the opioid settlement agreements and getting a lot of funding to a lot of the organizations probably in this room through his work. The Life Care Specialist Program that was recognized for its innovation and service, the medical professionals, the law enforcement, the community advocates, all those who have lived experience that have been here today, that you've heard from today, who are living through this each and every day. As commissioner of this department, I see each and every day how the AIDS epidemic touches every corner of Georgia. Does not matter if you're from the city of Atlanta or if you're from Thomasville, Georgia. The opioid epidemic has touched lives in all these communities. Too often, stigma, silence is the call for help. Too often the resources that exist in the metro areas are just not present in rural Georgia. But we're working every day to change that landscape. As a rural Georgia native, I know just how important having resources close to home is. Quality care should not be determined based on your race, your religion, your creed, or your zip code. Every Georgian should have access to the same level of quality health care. And I know that is something that this facility and this institution at Mercer is in their mission, it's in their blood, and they're making sure that happens every day. Governor Brian Kemp and the Georgia General Assembly has made great strides over the last several years in this fight by creating and empowering the Behavioral Health Reform and Innovation Commission to do its work, which led to, like Dr. Sumner said, House Bill 1013. It also led to changes in the legislation that added an addictive disease standing subcommittee as part of that work that is meeting on a regular basis, and I'm excited to see their recommendations come forward at the end of the year and the end of next year. It's funded the three Georgia Recovery Campaign recovery bus tours, and hopefully everybody's going to stick around and take part of that. Thank you to the Georgia Council of Recovery for being a great partner for our organization. You know, somebody asked me one day, said, what's the purpose of that bus? And I said, that bus is bringing hope to every place it stops all across Georgia. To the person who's in active addiction that sees that bus on the interstate and recognizes that there's a better way, that recovery is possible. But it also restores hope to those individuals living in recovery each and every day, and it lets them know they're not alone. So thank you for everyone that's participating in that tour and for every stop that's being made. Also to the Georgia Assembly Working Group on Addiction. Over 100 members of the Georgia General Assembly, bipartisan members, Democrats, Republicans, working shoulder and shoulder on this work every day. And if you turn on the news, you would think they never even talk to each other. But on this issue, they're united. And the Georgia General Assembly have passed numerous laws, including some that you've heard about today, including putting naloxone, Narcan, in every single school building. And we're getting ready to roll out an announcement. I said this at the recovery lunch at Buckhead Club the other day. But we're going to be partnering with, the trust is going to be partnering with the Department of Education, and we're actually going to be purchasing a Narcan box. Some of you have saw the box for every single school in the state. That's over 2,300 schools providing Narcan masks and gloves and directions on how that should be used. And those will be being distributed over the next 6 months so that that'll be accessible no matter where you live in Georgia. But yeah, thank you. Beyond this work, I'm proud to share that the progress of the Georgia Opioid Abatement Trust is making, and I know you've heard about that today. I'm proud to stand in front of you as the trustee of that trust and of those funds, and I am committed from the very beginning, and I'm committed today to make sure that every single dollar is used wisely and it's used transparently, and that we move the needle in Georgia, and that we're working hard to build a foundation of treatment recovery that will last for many generations. Already, the trust in its first round of grant funding distributed $70 million. We're currently reviewing grants both at the regional level and the state level. And in a couple of months, you'll see announcements go out on grantees for another $30 million, bringing the total to $100 million in grant funds going on the streets here in Georgia. The trust exists to make sure that communities most impacted by this epidemic are the ones most supported by healing it. These dollars are determined, how we distribute these dollars and how much each region of the state gets is actually determined by the harm that has been done in that region. So if you live in a community, you live in a region that's had more overdose deaths, there's more opioids prescribed, there's more ER visits for overdoses, then that community is going to receive more funding because there's more harm in that community. We all know that government alone is not going to be able to solve this crisis. Policy and funding are important, but the true change comes when people come together as you have today and refuse to accept that overdoses and addiction is the end of the story. That is why we're closing today's conference with a celebration of recovery with the Georgia Recovery Bus Tour. This bus is a rolling symbol of hope. It carries the stories of recovery into communities, reminding us that there is a better and brighter tomorrow and that recovery is real. Please stop by our recovery celebration where there'll be live music and fun for the whole community. In closing, I want to again thank you for everyone participating, the leaders that put this program on. Let's leave here today with a new shared determination to take this information back to our communities, to our partners, and not to stop until every Georgian, rural or urban, has a fair chance at prevention, treatment, and recovery. Together, we can write a different future for Georgia. Thank you for being here today, and thank you for your continued work, and I hope to see you at the celebration tonight. Thank you.
Thank you so much. And we have reached the end of our day. It was a marathon, but wasn't it a great day? Just a fantastic day. Absolutely. Thank you to Cammie and to Dr. Sumner for putting together a fantastic time for us to come together, to all of our speakers. This is very important, particularly if you are a physician, advanced practice provider, nurse, behavioral health provider, or have certification in addiction. You can take this. Once you take the evaluation, we'll get a list that comes to us, and then we will forward an email to you on how you can get your certificate if you're a provider that needs that for behavioral health for your particular board, or we'll send you continuing medical education or continuing nursing education. So it's very important that you take that. It's also very important that you take it if you're anyone in the audience, because we want to know what you want to do next year. This is the beginning. This is the beginning of a wonderful partnership, and I want to see you all together next year. Bring a friend. We want to pack this out till we have to have this in the arena. Because we have so many great people involved in that. But please take the time to take this evaluation, and then you entered from this building here at the University Center on this end where the parking lot is. If you will just go out of here and make a left, you'll go to the back of this building, and that exits right onto Cruz Plaza. So you can stay where you are parked and just walk right there to Cruz Plaza and enjoy the Recovery Bus celebration. It is a great time of hope to enjoy one another, to have fun together, and to celebrate recovery. So we hope to see you in Cruz Plaza. Thanks so much.